Good morning to you, good evening rather. Good evening to you all, respected student. Actually, I was thinking of making a video actually to tell you, or rather to give my experience actually what I did about 17 to 18 years ago as a when I was just like you, when I was preparing and when I got selected in at that time it was called as the All India Postgraduate Medical Entrance, and or equivalent, it is NEET that time, whatever. So uh, I want to share some experience with you, and many in the Facebook or in the WhatsApp I use see, and I feel very sad actually that many people are not turning up to take non-clinical branches or paraclinical branches. They are always inclined towards taking clinical branches. So it is not that since I have taken, I am a clinician and I have did my post-graduation in medicine, and thereby I did my postdoctorate in medical oncology and nephrology. So it is not also my aim to that I am canvassing to take you all non-clinical branch, and it's not like that. But I was thinking, and it made me really very painful to see all my younger, respected younger juniors who are preparing day and night, because only only a person who has passed, who has gone through that painful stages of preparation can only understand that the pain. And I am understanding that you are, and for you all, the pain is even much more high. So and this is not a motivational, I am not interested in this motivational video or something like that. It is just a suggestion from me. So I thought to make a short video and to tell you my views, and though no one has asked my view, but still it was my moral responsibility to tell. Now actually many people are now, actually the trend has changed. Many people are telling that no, we should take medicine, or we should take surgery, or we should take orthopedics, or we should take eye, radiology, then radiation oncology, then immunohematology, because they are a better prospect, they give good scope, and it is easily we can get job, and we can be established, and we can be very famous, calling themselves as a medicine postgraduate, or a radiology postgraduate, or derma postgraduate, or a psychiatrist, or whatever. But I am feeling very, but people do hesitate to say that they are postgraduates in pharmacology, or they are postgraduates of anatomy, or they are postgraduates of forensic medicine and toxicology, or like that, which I have gathered experience. The new trend which has begun just in last 8 to 10 years. So I just want to share you one experience. One of my dearest friend, actually he is now no more, and you might be knowing, because he was also very famous, because we two were very good friends, though we were not from same medical college, because he did his postgraduates in forensic medicine and toxicology from Stanley Medical College, which is in Chennai, and I did my postgraduation from Patna Medical College, Patna, which is in Bihar, and he did his postgraduation, which is in Stanley Medical College, which is in Tamil Nadu. So there was a great difference, and we are also of not same subject, because he did his post-graduation on forensic medicine and toxicology, as I told, and I did my post-graduation in medicine. But why we came close to each other was the same, one of the very only one thing which attracted him towards me or me towards him, was that thirst for knowledge, and passionate for teaching, and passionate for learning, updation, because we are in continuous learning. Despite I am now a professor, and I'm very sorry to say, because he is now no more in this world, because he died 2 years back due to some cardiac issues. So just giving him condolence also by through this message, because just I remember he also used to say that I didn't get a very good marks in my All India Postgraduate Medical Entrance, which is NEET, because earlier it was AIPGME only, and not NEET, so it is equivalent. So in our times when we gave NEET, he did not score well. He scored some in 1,000 or 40,000 or 50,000, something like that. He used to tell me, and now then all his colleagues, his friends, which is used, who were teacher at that time, his friend there, where he passed his MBBS, because he passed his MBBS perhaps from Guntur Medical College, and where I passed from my MBBS from abroad, MBBS thereby from Russia, from Moscow, thereby coming to India and giving the FMG. So he had not that pain of passing the MCI examination. I had to pass the MCI examination. So that it is also given in my Facebook also. So that is not the issue. My issue is that now the student all which are coming, I don't know why they are attracted so much towards clinical branches, because you see, if you be a good clinical biochemist, or if you become a consultant biochemist, or if you become a good pharmacologist, or if you become a good anatomist, could you think that there will be no job? Because many times I see that in the Facebook or in some of the groups it is written that I got this rank and I want to take surgery, but will I get surgery or will I not get surgery, or if I don't get surgery, whether I will prepare or not. But nobody canvasses, or nobody supports that taking physiology as a branch, or anatomy as a branch, or biochemistry as a branch. I don't know what is the reason behind it. Why? Because is it a shameful branch, or is it some branch which I have to hide and I have to do not tell to everyone? That's not like that. Because see, just I am giving you one example, and then I will come to my friend what he said and what he was now, because now he is no more in this world. So the thing is, a medical oncologist like me, now suppose I am seeing a particular tumor, or I am seeing, or treating rather, I am treating because I am a medical oncologist, so naturally I will be needing help from my fellow colleagues. I may be referring to radiation oncologist, and if required to surgical oncologist, and to my fellow surgeons also, to see whether it can be what are the his opinion or her opinion about this particular tumor, whether it is a laryngeal tumors, whether head and neck tumors, whether it is a lung tumor, or whether it is a CNS tumor, or whether it is a lower GI tumors. So the thing is, if all people take like medical oncology, or if all people take medicine, I am strictly confined to broad specialty only, because I am not going to super specialty right now. I am telling for in broad specialty only, because if all people take only medicine or surgery or immunohematology or like surgery or orthopedics or eye, so I don't understand this way that okay, now if for example you are seeing a, like suppose you are a PG resident or you are a I am talking of my branch only, medicine. If you are treating a patient of like suppose rheumatoid arthritis patient or sarcoidosis patient or if patients on PEO, pyrexia of unknown origin. So now how would you know, how would you diagnose it? A pyrexia of unknown origin, how would you diagnose it? Telling that it is a it might be we can define as per book or what our professors has taught, and what we have gained through our experience, that after 3 weeks or 4 weeks, if the fever does not get remitted due to fever does not gets over due to giving medications, then we can label it as PEO. I am keeping this as simple as that. And so then what? Then before that I have to give the battery of tests. We have to give urine examination, urine routine, urine culture, blood routine, even if required blood culture also. So you tell me just a simple thing, that who will do the blood culture? Who will do? Just please tell me. And I give the blood culture and I write in my prescription in a very stylish way that I am a medical oncologist, so I write that blood culture should be done because I am suspecting it to be a PUO, and a urine routine or urine culture and urine for cytology examination also, because I want to also see to rule out any other absurd causes. So who will do all this test? Who will analyze and who will see that what are the pathological or microbiological findings? Not a medical oncologist like me. I am totally and I am fully dependent on my fellow colleagues who are the postgraduates in microbiology, who are the postgraduates in pathology, who are the postgraduates in biochemistry, etc. So why there is a great disparity? Why there is a great deviation? I don't still, because and not like that I have passed my postgraduation long days ago, and I am so old that I am not able to find the difference or what. Difference is there, because why the people are not deviating in the, and first of all the thing is that why non-clinical and why clinical? Because each and every 19 subjects is clinical. Because without the knowledge of physiology, how can you ever expect, how can you ever think of labeling it as a fever? Because what is fever? The definition of fever we all know. So where the definition has come from? Is it come from medicine? No, it has not come from medicine, it has come from physiology. Then what is if we suspect a patient of, like suppose a patient has come for a chest pain, or a patient has come for like suppose chest pain only, because I am not going in the entire detail. So when I suspect a chest pain, I tell that patient to do an ECG, and for the timing, if the patient is acute, I give some sort of anti-angial drugs, and then either I refer him to the super specialty, and that super specialty guy also, who is a cardiologist, who is my counterpart, because I am a medical oncologist, so a cardiologist will better know that position, that why he is having so much pain in his chest, ruling out the other causes. So like also he will also be depending upon his fellow colleagues for TROP-T test and for the other ancillary test, and then the biomarkers and the cardiac markers, the CKMM, CKBB, CKMB, LDH. So all these tests, who will do them? A medical oncologist or a cardiologist or a biochemist? You only tell me. Who will do? And if all we are in cardiology and medical oncology, then who will do the test? How will we cure the patient? Have we thought in that perspective? Because if everyone has become has dreamt of taking a branch, either so-called cream branch or good branch, or I don't know what sort of name, because at that time we don't go, because when I passed my post-graduation way back in, I told you, about 17 years ago, when I went in 2008 to do my post-graduation, we did not have this disparity. We did not have, and still I am not having this disparity, neither my batchmates have this disparity. Now what my batchmates generally have, that presently I can't tell, but about I am fully confident that I don't have that disparity, because I have to depend on my fellow senior or junior, whosoever it be, a pathologist or a microbiologist or a biochemist, to see that what my patient is suffering from. So because now I'm coming to the point, because your results are out, your results for both the NEET PG as well as those who have given UPSC. Even for I am also telling for UPSC. Now I am coming for UPSC. Many people, because many people have given UPSC, and though I have when I was doing my when I started to prepare for my NEET exam, as I told you 15-17 years ago, at that time also UPSC was there, Combined Medical Service was there, but I was not so much fortunate to give that exam, because really the Combined Medical Service is a top class exam if you compare with the NEET exam, more or less, because it is a matter of pride to get a Ashok's on while preparing preparing for UPSC. So today my video is only to tell that why people hesitate and why people don't deviate towards taking non-clinical branch, why they are so much obsessed of taking it is obsession only, it is a type of obsession which we study, and which I study rather in psychiatry, this dermatology and this surgery and this medicine, then these branches, these clinical branches has become a obsession nowadays, because, and I don't know why, and why the obsession is not for anatomy, because now even in urban, in highly populated city, in high metropolitan city, now the gynecologists are preferring the embryologist first, and for embryologist you need not to be a gynecologist, you have to do post-graduation in anatomy, that you already know, I think. So, and there is a very good scope, because I was fortunate to, once I visited in Mumbai and though I go frequently for my classes and for for any conference or something, I was passing through that fount. There is a in just near it was near Parel or something. It was near Tata Cancer Hospital. I was passing through that, and there is a as far as I remember, there is a children's hospital, Wadia Hospital, Children's Hospital, something. And just after that, I saw a huge building, and it was some of the husband wife. They are both gynecologists, and another person who is also partner in this group, and but he was not a gynecologist, he was a anatomist, and he was a consultant embryologist. So I am telling because what we because I am not telling a story. What we got the conclusion from this, we got the conclusion that every subject, each and every 19 subject, each and every subject is of utmost important. Whether it's like a what? It is like a bus, or it's like a four-wheeler, because if in a four-wheeler cannot move, no, if we just take out one wheel and tell that four-wheeler to move, it will not move, it will break down, it will top, it will just triple. So just not more than that, because so just I am not requesting, I am not forcing you to tell you that no, don't take the clinical branches, take non-clinical branches. But the thing is that it is not insulting that to take a postgraduate who is a postgraduate in biochemistry is equally same as one who is a postgraduate in surgery or orthopedics or ophthalmology or surgery, whatever. So he or she cannot be called a less, because without her or his, we are nobody. So my intention was this only, because when I see in the Facebook, I feel very upset, because I feel upset of my sacrifices, because what I studied and how I competed and how I got selected in getting All India rank of 429, and thereby getting because at that time there was neither any sort of mobile or any sort of this videos and all, whatever I am conversing to you, one-way conversation or something like that. There was a trend, and we were deviated to that trend and taking that, okay, अगर डॉक्टर बनना है तो अगर या तो इंजीनियर बनो या तो डॉक्टर बनोगे तो पास करोगे MBBS तो फिर मेडिसिन ही पढ़ना है, and thing like that. So because as far as if we strictly come to my family, because my family में कोई no one is doctor, कोई भी डॉक्टर नहीं है. So my father was an engineer. He passed his engineering from IIT Kharagpur. So what engineer will help you? I was fortunate, thanks to my Almighty and thanks to my parents, that I, luckily or unluckily, whatever, I don't know, but blessings of my parents, my father, my mother, especially my mom, who always used to dream that my son will be a doctor. And I don't know, because I was not a very good student. I was not a very brilliant student or very gold medalist type of student, achieving very good marks in my school timing. But despite that, she always used to dream, and her dream was fulfilled, whatever. And my way of speaking in English was also not good. So, because I don't even being reading in English medium school, because at that time in Bokaro, the St. Xavier school was of the topmost at that time, because I am telling about in 80s and 90s when I was in school. That school was recognized as a topmost school. It is a top-notch school. And I was not being able to tell very frankly, very fluently English also. So thanks to medical science, or thanks a lot to my teachers, to my professors, and I bow to them, because many of the professors are still there. Many of them have left this world, and I still remember them, and I pray a tearful condolence to them, because for them and for going in my medical college, where I started the ABC of my medicine, first Moscow, I learnt English, and after going that, वहाँ पे जाने के बाद मैं I learnt all. In fact, हम हमको तो बोलने ही नहीं आता था, बिकॉज हमको तो इंग्लिश जब बच्चे वहाँ पे जब सीनियर लोग बोलते थे तो हमको इट वाज अजीब, बहुत अजीब लगता था हमको कि मैं पता नहीं बोल पाऊँगा कि नहीं पाऊँगा. एंड थैंक्स टू, अगेन आई एम टेलिंग, थैंक्स टू माई ऑलमाइटी, my parents, and especially my mom, my mother, who was herself, her qualification, as I told of my father, was engineer. She was just a illiterate, but she always used to dream of me becoming a doctor, and she used to tell me also when I used to, in my graduation time, in MBBS time, when I used to come from Moscow to India for some holidays or something like that. Because it is a matter of 20-25 years, again going back to 2003 when I passed my MBBS. So, and we were perhaps the second batch when the MCI was implemented, because earlier the MCI was not implemented, because you all students might not be knowing that, because we passed from that painful stage. So I am not discussing all these things. I am only discussing only the few things that please do not depress yourself if you get if you do not get a decent rank, and if you are taking biochemistry, or if you are taking physiology, if you are taking forensic medicine. No harm, please, no harm. And there is each and every scope for each and every subject, and each and every subject had its own essence. So please be patient, and please, though I am not telling, I am not because many of my close friend who was my batchmate, who is a postdoctoral in urology, who is in hospital right now, tells me कि अरे यार तुम तो खुद मेडिकल ऑन्कोलॉजिस्ट हो, लेकिन तुम हमेशा बायोकेमिस्ट्री का पैरवी करते हो, फिजियोलॉजी का पैरवी करते हो. नथिंग सॉ ऑफ दिस. मेरा ये मोटिव नहीं है. माई मोटिव इज़ टू दैट ईच एंड एवरी सब्जेक्ट, एज आई टोल्ड यू, कि मैं उसको भी बोला, मैं आई टोल्ड टू माई फ्रेंड ऑल्सो, कि भाई अगर हम वी ओनली रिमेन इन बिकम a postdoctorate in oncology, or postdoctorate in urology, or postdoctorate in neurology, or I'm coming to you, a broad specialty in medicine postgraduate or a surgery postgraduate. How will you tell me? How will you get your result? How will you diagnose the patient? Tell me. Explain me. So this is a wrong way. Totally, it is a very wrong way of judging ourselves. It is a very wrong way of judging ourselves, that we get a rank, and we always deviate, or rather be eager to take clinical branches, not focusing or not, and seeing the non-clinical branches as a as if we are criminals, we are getting this branch, nothing sort of that. Please don't. It's my request, and it's my heartful request to you, that don't ever get depressed. And I'm telling you that the same importance is that of clinical, and same importance is that of non-clinical. It is nothing else like that. And please take your branch wisely, and study that. Each and every branch is important, because as I told you, because I will not bore you by telling you and increasing my video telling, not like that. Just my aim was that to tell that each and every branch is important. That's the main aim of my video. Because again I am telling that if you are a medicine, or if you are a surgery, if you are a orthopedics, if you are a pediatrics, if you are a radiation oncologist postgraduate, you are no one. If you do not get any support from a consultant, your fellow colleague who is in biochemistry, who is in physiology, who is in anatomy, so, or pathology, whatever, you are just a failure. You can't do, you are helpless. So please believe in yourself, and rest you leave on God, because He is there, He is looking. And don't get depressed on the ranks which you have achieved, because it's whatever rank you have achieved, it's okay, and whatever the branch you are getting, that's also okay. Now don't try to tell that I have given, I got less number, so I will be preparing again. See, preparing again, I'm not telling you not to no, not prepare, don't prepare again. You can prepare, but that should not be excuse, okay? That should not be excuse for I mean, that should not be any excuse for not taking this non-clinical branch. That I was मैं फिर प्रिपेयर करने आ गया यार, क्योंकि क्या वो रैंक तो अच्छा नहीं मिला, वो एनाटॉमी मिल रहा था। तो एनाटॉमी मिल रहा था तो उसमें बुराई क्या है, ये तो बताओ हमको। व्हाट वाज द रॉन्ग इफ़ यू आर गेटिंग अ PGT seat there in anatomy? Because without anatomy, a radiologist, a consultant who is a very good radiologist, who is my colleague even, so what do you think? If he does not know a good anatomy, can he be a good radiologist or what? Tell me, explain to me. Because now as such I don't know, radiology is considered to be a cream branch. Since I am in teaching, teaching to my NEET PG student and UPSC student also, and many a times it is told that is a cream branch, then comes medicine, then comes dermatology. I don't know who has given this classification of cream and cream, tone, double tone, I don't know. But the thing is that a good radiologist is a very good anatomist also, and good medicine postgraduate, first of all, is a very good physiologist, and then he is a pharmacologist too. So we should not judge ourselves by telling that, okay, I have got physiology, so I am a bad student, I have not got good marks on it. That should not be excuse. And preparation is a separate thing. If you want to prepare, you prepare. You are welcome to prepare. Of course you must prepare, because if you have not got the good branch, if you have not got a good rank, you have to improve your rank. Okay, you prepare. But that should, again I am telling, but that should not be any excuse. I mean to tell, that should not be any biasness, because now whatever I see in the Facebook and WhatsApp is, now there is a biasness in the in studying. So that only I want to tell from this video. That was only my aim to convey through this video, that please don't judge yourself by taking, if you take a non-clinical branch, don't depress yourself, because there is nothing called non-clinical and clinical. I told in my starting video only, there is nothing non-clinical, everything is clinical now. And before also, at 50 years away also it was a clinical, and now also it is clinical, and after I die or we die, then also it will be clinical only. So that's only. And don't get depressed. Your counseling is, not counseling, your rank has just come. Whatever the branch you are thinking to take, and you are getting as per the trend, you take that. And and if you prepare, again I tell that if you prepare, okay, I am not satisfied this time, I will wait for a year and then I will prepare. So that should not be an excuse that अगर मैं रह जाता तो काउंसलिंग में हमको पेरिफेरी में या हमको DNB में हमको माइक्रोबायोलॉजी या पैथोलॉजी मिल जाता, तो इसका क्या मतलब है? देन व्हाट इज़ द मीनिंग ऑफ दिस? द पैथोलॉजी इज़ नॉट ए गुड ब्रांच. अरे पैथोलॉजी, जो पैथोलॉजी के पोस्ट ग्रेजुएट्स हैं, जो पैथोलॉजी के जो पीजीज़ हैं, जो प्रोफेसर्स हैं, उन्होंने हमको ठीक से ग्रॉसिंग का रिपोर्ट नहीं दिया, तो मैं खाक ऑन्कोलॉजिस्ट हूँ. दैट्स इट, एज सिंपल एज दैट, नथिंग एल्स. रेस्ट यू आर yourself a doctor, you are a medicine graduate, you know nothing from my side. I think you have understood. So this is only my thing to tell to you. That's it. Thanks a lot.